Alright, so you're here because of back pain and the left hip pain.
Mm-hmm.
Let's talk about that. You did write and check off other stuff in the intake. If you want to talk about it, I could talk about it. I would like to
Sure.
talk about it and address it if necessary or if I can do. Okay. Alright, so then go ahead. Say whatever you want.
Okay. Well, I've had lower back pain for several years now, and
Mhm.
it's just progressively gotten worse. Um, and to the point where rather than ignoring it, I went back to my primary care doctor and talked to her about it. And she did an x-ray, and she determined that my L2, L3 were smushed, was the word she used, and has referred me to PT. And I've been doing PT for months now with no real marked relief. Maybe a day I feel better and then it comes back, or, you know, it, I just feel that it hasn't taken care of it.
Okay.
So, I'm a desperate woman.
Yeah, well, you gotta live life. Yep.
Yeah, and it's impacted. I haven't exercised in a very long time.
Constant pain, yeah.
It's pretty constant. Like today, it's constant. It's all day. In the middle of the night.
Yeah, up and down depending. Right.
Yes.
What about middle of the night?
Sometimes in the middle of the night, if I cough, it's so painful. My lower back will be very painful. And then again, I can have a couple of days where there's no pain, which could relate to the PT, but then it comes back within a day or so.
And that's how do you say? A couple of days no pain. How many times does that occur in 1 month?
A few times.
Okay. A few times.
I'm more in pain. It might be a little less, but it's almost always there.
Almost always something there.
Yeah.
Okay. And then you do something a little bit, and that's excruciating.
Mm-hmm.
What about in the morning compared to night, compared to during
Morning's
the day?
the worst.
Okay.
When I wake up, it's the worst, and then I'll do stretches. And as the day goes on, it often lessens.
Okay.
And I'll walk, or lift weights or try to do some bands for hip strength, but
okay.
But it seems to exasperate it, so then I stop.
All right. Easily aggravated. So you're cautious, and you have not been exercising for a long time.
For a long time. Any really good exercise.
Yeah. Okay. What about the hip? What's going on with that?
Well, I feel like it's related. It's sort of my lower back, the whole lower back, and then it feels like it kind of radiates into my left hip.
Okay.
But it feels like it's all connected, or it
Alright.
appears to be.
It feels like more like a radiculopathy, possibly.
I don't know what that is.
Alright, it's just radiating pain.
Yes.
That's what it means.
Yes.
Okay. That's different from arthritic pain, because that's a separate condition.
Yeah, I don't feel it's arthritis. I feel
Okay.
like it's more muscular.
Okay. Alright. So then, let's do a little bit of interpretation and application, and then talk about application, do the application. Interpretation, okay, there's functional and there's material. Functional means it's related to soft flesh, like spasm, mild strain, or sprain strain, so those are mild tear, okay? Then that's different from hard to flesh, which is your spine and disc. Your discs are not, or discs, or disc is, you said L2, L3, so it looks like it's just one disc, or it could be two discs.
No, it's one that's
Okay. Yeah.
on top of the other.
On top of the other, meaning your disc is not there, almost not there, right? And so then what is the recommendation? I think the recommendation is either fusion or disc replacement or physical therapy, whatever, but you start with conservative.
Yes.
And then you go to the next and next and next, right? And you've done the physical therapy, which means to me is that you set yourself up for better improvement than otherwise. And I hope acupuncture works out well for you, where it's less intense less frequent, and shorter in duration.
Mm-hmm.
That indicates that you're doing better. How much can we get rid of, and how much needs to be maintained? Don't know. Because some people with issue, they're symptomless or they have low symptoms. Okay, so then the material doesn't really indicate what it does, but not all the time indicate how it should be. Right? And then acupuncture, majority of people who come here are in some kind of a joint pain.
Mm-hmm.
Right? Most frequent is back pain. And majority of people have been there, done that, and things are stubborn. Acupuncture is not the first choice. You've had acupuncture before, but this is a different way of approach. You go to 10 different acupuncture, same condition, they all do it differently. So who's gonna fit with you best, right? That's really more of a question. Because there's another factor. There's obvious reason why you have pain, but there's, again, majority of people come here and they get acupuncture and they get better. Alright, good. Then this is relevant. Then how much better and when should you start noticing improvement? Give it 6 to 8 treatments, then you know how well you're improving.
Mm-hmm.
Okay, you may start improving after the first treatment, about 1/3 do. Okay, but you give it enough treatment, then you see a trend.
Mm-hmm.
Less pain, less frequent, shorter in duration, right? And I hope you meet all that significant enough that it's encouraging for you to continue, and it's not as easily aggravated either. So you're more active, and
right.
You're not as aggravated. And when you are aggravated, you recover faster.
Mm-hmm.
Okay.
That's
so
it.
you
And
gotta meet that first criteria, right?
Yeah. I'm not even, I don't know that back stuff has anything to do with the L2, L3. I know that my back is also very tight. The muscles are.
Yeah. I think it comes with that.
Okay.
Yeah, it will come with it, and then I think I'll need to say this: knowing what you have does not tell me how to do acupuncture. That's
Right.
a funny thing, right? Because if you don't know what's going on, how are you gonna treat? It's to that question. Because it's problem focused. The model is problem focused that we know of. But in the world of natural medicine, it's not problem focused, it's person focused. You
Mm-hmm.
heal you. You deal with yourself, and I support you to do that in the way that I know how.
Yes.
Okay. Yeah. That's why I don't have to know the condition. All you have to know is your subjective symptoms.
Experience.
Yeah, it's subjective issues, subjective experience, subjective symptoms, and you compare that from before to after, because everybody has their own particular characteristic anyway,
Mm-hmm.
right? So those are better over time. Then okay, something right is happening. That helps a bit.
Yes,
Yeah.
it does.
Okay. Then we could start on acupuncture now, unless there's more you want to say. All right, go ahead, take off your shoes and your socks. You're ready to start. Okay, you're that excited. Then I have to deliver that much.
Yeah.
Right.
Don't feel any pressure, but making you well.
There's got to be a little bit of pressure, right?
Yeah.
Yeah.
And-
Watching that Olympics is like,
Yeah.
people gotta feel the pressure.
That's right. Feel it.
And it's over there, and legs are up there.
Do you want me to take this off or
You can leave it on. It's
Okay.
fine. Yeah. Yeah. 'Cause-
on my back?
yeah, facing up. There's no acupuncture on the back.
Oh.
Yeah,
Okay.
I'll explain. And
Okay.
Again, it's my own way. I'm not saying I'm right, but it's just.
Well, I hope
I
you're
find
right.
this to be helpful, right? Because I've been doing it this way since 2005. I've been doing acupuncture since 2000, and you've heard about me over time. So it sounds like I've been doing something right,
Something
even
right.
with the same technique.
That's right.
Okay. Right. Lift your legs a bit and sit down. Okay. Good.
I haven't had acupuncture in a very long time.
Oh, you were one of the first, huh?
Many years.
Okay. Start mouth again. Thank you. Let's pull this up. Okay, you could place your hand up here. Good. Alright, now I'm going to wipe the spots with the alcohol.
Okay.
Clean the area first. I'm going to check your forehead temperature. It's my way of seeing how you're doing with acupuncture before and after. Okay, these are acupuncture needles. Sterile, use once. Yeah. Okay, and these are tiny.
Yes.
Okay, we'll do one at a time. Here, how's that? Okay, alright. Here. 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 Okay, and there. Okay. Here, are any of those too sensitive?
No,
Okay.
a little stingy, but they're okay.
Alright, and they've subsided, right? They're okay right now?
Yeah.
Okay. Let's talk about this a little bit, because it doesn't make sense you're getting acupuncture in the hand, finger, leg, and the foot, just on one side. Well, I'm going to say things in different ways here. First off, there's a reason why I don't give you acupuncture in your back.
Okay.
Because if it's that good, it would be practiced everywhere. It's not about belief, it's like so easy, right? Just transpose the points to where it hurts and voila.
Right.
Right, that's such a low-hanging fruit. Anybody who knows anatomy can do it.
Right.
Okay. But the efficacy has to be there. If it's not good enough, then who's going to take it on? Okay. Alright, so then there's that logic. And then then how come there, right? Why acupuncture in the hand and the leg and the foot? Well, it's because it's person focused, not problem focused. Okay, with that idea, these acupuncture points are master switches for you. Or you could say they're bullseye of the target. Or you could say they're major nodes within the network. You are a network. Everything is directly and indirectly related. And there are major nodes. When you access them, everything gets affected more efficiently. So it gets your body involved in healing that area. That's what acupuncture is about. Yeah.
So would you be putting them in the same places for
yes.
adrenal fatigue? Or?
Yes. Ooh, you're making connect. Yes, because everything is directly and indirectly related, and get your whole body involved means that yes, adrenals are influenced. Let's say you have a headache. You came in for just headache, not for back pain. Same points. You have hot flashes. Same spots. We say holistic, not for no reason, because it's not comprehensive. It's like, okay, it's holistic. Okay, not only that, these points are constitutional. Constitutional means that you're born with these reactive spots and they're the same over time. My job is to identify, find them. How do you know? By your improvement. Oh, this works for you. Okay, let's repeat it. And then it adds to the benefit. The more you get, the more benefit you get. And your momentum towards health and well-being is higher. Your body's taking over more and more. Okay. So, yeah, I see that registering by your expression.
Yes, it is.
Yep. Okay. Any thoughts, questions, comments?
No.
All right.
No.
Yeah, so you get to rest for about 25 minutes.
Okay.
I come back in the middle of the treatment in about 10 minutes. I add more on the same spots, and yeah. So that's the acupuncture process. And when I come in, or if you want to say something, go ahead, and perhaps I'll have a reply.
Thank you.
Okay. You're
Good.
welcome.
Don't forget me.
Oh, definitely not.
Don't.
Or somebody will find
Don't
you.
pose up to yeah, the janitor at midnight.
Okay. Well, let's just say longer the better.
There you go.
Hope so.